We now will welcome our panel to the main stage. We have the privilege of having Congresswoman Underwood moderate this panel of really incredible champions and advocates. So go ahead and join us on the main stage panel. We will be talking about policy and solutions to close gaps in maternal mental health disparities. Welcome all. And Congresswoman Underwood, I'm happy to turn it over to you.
Well, thank you, Joy. And hi, everybody. I am so excited about this panel. We are so grateful, obviously, for the recognition as the 2022 Maternal Mental Health Hero Awardee. And I am grateful for everything that Joy and her team at 2020 Mom does every day. I am delighted to be joining today's conversation with such an esteemed group of speakers. And I'd like to kick off our panel discussion by having them introduce themselves. So Kay, I will turn it over to you now.
Hi, everyone. Kay Matthews, Executive Director and founder of the Shades of Blue Project.
Thank you, Kay. Teresa, could you please introduce yourself?
Hi, I'm Teresa Fortune, the filmmaker of From the Ashes and the founder of Communion with the Community. Thank you.
Great, thank you. Thank you, Teresa. Emily, could you introduce yourself?
Absolutely. Good morning. My name is Emily Miller. I'm a maternal fetal medicine physician and a health services researcher. I'm the founder and medical director of Compass, which is a perinatal collaborative care program at Northwestern in Chicago.
Thank you, Emily. And I'll turn it over to Amy now.
Hi, everybody. My name is Amy Chen. I'm a senior attorney with the National Health Law Program.
Thanks, Amy. And last but not least, I'd like to introduce Anna.
Hi, everyone. I'm so happy to be here. My name is Anna Benyo. I'm a senior program officer at the Center for Healthcare Strategies.
Great. So when we co-founded the Black Maternal Health Caucus in April of 2019, I co-founded the caucus with Congresswoman Alma Adams from North Carolina. I'm sorry, I missed one person. Yvette. Is Yvette here? Hi, Yvette.
Yes, I'm here. Hi, good morning. I am grateful and honored to be here. My name is Yvette Fullerton. I am a clinical social worker, certified perinatal mental health provider, and the co-founder and director of the Siwa Buckley Collective. We are a grassroots organization based out of Phoenix, Arizona, that was created to address maternal morbidity in our community by revitalizing traditional birthing practices and supporting birth workers of color in the community. Thank you.
Thank you, Yvette. I apologize. So when we founded the Black Maternal Health Caucus, I worked in partnership with Congresswoman Alma Adams from North Carolina. And our first legislative goal was to identify all the gaps in existing federal maternal health legislation. One of the main issues that we heard about from stakeholders across the country was the need to address maternal mental and behavioral health, which is a leading driver of maternal mortality and severe morbidity that is too often overlooked. It's under-discussed and over-stigmatized, and it's a concern that can be especially prevalent in communities of color. In my state of Illinois, our most recent maternal morbidity and mortality report found that mental health conditions, including substance use disorders, were the #1 cause of pregnancy-related deaths in our state. And that's why it's so important for us to develop legislation to expand access to maternal mental health care, including community-based programs, the mental and behavioral health professional workforce, and evidence-based perinatal suicide prevention initiatives. And that's exactly what our Moms Matter Act would do. It's a bipartisan bill within our Black Maternal Health Momnibus Act. And we all know that the Momnibus is a suite of 12 bills that build on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in America. The Moms Matter Act includes robust funding to establish a maternal mental health equity grant program, and it will grow and diversify the perinatal mental and behavioral healthcare workforce. The legislation passed the House of Representatives in November of 2021 as part of the Build Back Better Act. And I look forward to working with my Senate colleagues to get these crucial investments, historic investments, signed into law. Now, as we continue to lead this work in Congress, I know that the incredible women on this panel are leading critically important initiatives to promote maternal mental health equity all across the United States. So to understand what motivates them and the work that they do, I'd like to invite each of our panelists to share more about the needs that you've identified in the communities that you work in. And so we'll start with you, Kay.
Thank you, Congresswoman. So I started doing this work from my own birthing experience, right? I delivered my daughter stillborn. It was not the outcome that we prayed for, hoped for, right? But it was. It also was the turning point in my life because I actually had not ever really experienced being a Black woman until I gave birth. Everything that happened, my interaction with staff, the treatment, just all the way through was just horrible. At the time, I didn't, of course, know what I know now, but I did know that I was very uncomfortable. I wasn't getting the support that I needed, or because it was a loss, I just simply got pushed over to grief. Versus I'm a woman who has given birth and everything that happens after that, right? And so my struggle with maternal mental health and experiencing postpartum depression, that link to infant loss, it just wasn't there. And so I just struggled an immensely long time. But in the midst of my struggle, it just goes back to watching Teresa film, that invisible cape that we as Black women often feel we have to carry. That's what I had on, but I didn't want it, right? I didn't want it. Nobody asked me if I wanted it, so I took it off. And I was like, what is happening with me? But in my own recovery, I was like, how can I help someone else not feel this way? I want to be able to, any woman, to walk into a support group and get the help that she needs, no matter what her birth outcome was. Like creating something that is going to help everyone who is searching for help after giving birth. And so I created that little by little, step by step, getting into the community, really listening to what was happening. And when I say getting into the community, because I was a community, right? So I was just talking to people about how I was feeling. And then can you identify with this? And then I just started to see so many people in my immediate circle that was going through these things. And I was like, wow, who knew? Because it's not something that you talk about, right? And so then the issues around mental health after giving birth is usually something we say, oh, they'll be all right, that's normal. Really wanted to change that narrative. Like that was the push behind the work that we do. And so when I say community support, I truly, truly mean it. I am the executive director, but you will often catch me in the streets working, still doing the work, because at any given time, my situation can turn, right? And I can be right back in that same position, needing help and really hoping that the next time around, however it happens, that we have things that are in place that were not in place 9 years ago. Folks are speaking up. Programs are out there, the work is being done. So that's truly how I got into it. And so I serve from that very lens of how would I feel if that was me sitting in that chair? How would I feel if that was me having to struggle with filling out an application? So really creating a system of care that removes barriers as much as possible. We have to have systems, right? Because systems help things, work. But how do we create systems that don't create barriers? So how do we really move this thing forward? So that's the basis, that's the push of the work that we do here at the Shades of Blue Project. And there's so many moving little parts. We do what moves the work forward. So anything that we're involved in, it's because it's pushing the narrative to change how we look at women after they give, or birthing individuals after they give birth, and the care that they need, whatever that looks like.
Okay, thank you so much for sharing your perspective. Now I'd like to welcome in Teresa to offer some comments.
Hi, thank you so much, Congresswoman Underwood. Very much so like Kay, I began my journey around just expressing what my struggle was through postpartum depression, which was so severe to the point where I had literally contemplated taking my life. It was an unbearable amount of pain, discomfort, and I didn't really know how to express how I was feeling, nor did I feel comfortable talking to clinical professionals that kind of pushed me to the side. No one really thought to check in on my mental and emotional well-being as a first-time mom. Mind you, when I gave birth, I was also a Medi-Cal recipient. So with that being said, I didn't really feel worthy of even asking for help. When you're on Medi-Cal, oftentimes you feel like you are just a case number. And in the Black community, it is shifting in a positive way, but for many generations, we didn't really feel like we would ever be able to afford talk therapy or any other means of support, especially while being a Medi-Cal recipient. So because I could not afford therapy and I wasn't brave enough to start asking for the help that I needed at that point, eventually I just started documenting my journey in hopes to offer it as a blueprint for other mothers that were silently suffering. And in doing that, I decided to start a drama therapy production company because I didn't have to pay for therapy. So I literally began doing drama therapy dinner theater shows where I was allowed and given permission to bring in the community, reenact traumatic scenes, and then go into conversation. Like Kay said, when you don't have a lot of money, community becomes the currency that you have to rely on to eat, to survive. And that's what my community offered me. And it is my duty to make sure that I can offer this forward and to create more community for mothers that are in need. So that's a bit about my background, and I'm excited that this body of work is actually what transitioned me off of welfare. So yes, I quit my job. I had to make a decision. Do I want to really focus on my mental and emotional well-being at the cost of my paycheck? The answer was yes. And I had to choose, is it going to be my paycheck? Or is it going to be my purpose? So because I am actively in a space of purpose, this has literally been the opportunity to get off of welfare. And I've been able to monetize my artistic expression as a maternal mental health activist. So thank you so much.
Thank you, Teresa. Yvette.
Thank you, Congresswoman Underwood. I am listening to all this, and I can really relate in the sense of community. That is, like Kay and Teresa, I found myself in this work because of my own birth experiences and also the lack of support that there was. And the irony is that I was in the middle of my grad program as in my clinicals, getting my MSW, and I still was not able to find the right services and help that I needed that supported my cultural identity. And so one significant protective factor against racial trauma is cultural identity, a positive sense of oneself existing within and belonging to a certain culture, particularly one that has collectively experienced and overcome past adversities. And that's in the search of trying to find other women that look like me, that use the same terminology to relate to our postpartum experience. I found community, and our group saw a need in the community where a lot of women of color, specifically urban Indigenous women and Latinx women, were not getting culturally sensitive care, whether it was in maternal health and also postpartum and mental health. And without not trying to intend a pun, but Arizona is an actual desert, but there really is a maternal mental health provider desert there. And so we know that Black and Indigenous birthing people are 2 to 3 times more likely to die than their white counterparts in pregnancy-related deaths. And a lot of, at least 26% of pregnancy-related deaths were contributed to mental health. And we just don't have the services. And so we are a collectivist community. We heal in community, we recenter in community. And that is what drives our work, and what drives my work is I am a result of my community. I'm a result of my ancestors, of my teachers, of my friends, and the concept of healing for the next 7 generations is something that we really, really do believe in and strive for.
Thank you. Let's hear from Emily next.
Thanks so much. Gosh, what powerful narratives. Thank you all so much for sharing. As I mentioned before, I'm a maternal fetal medicine subspecialist. And what that means is I went through 11 years of training after undergrad to learn how to do some pretty highly specialized things, surgeries, fetal interventions, learn how to safely deliver medications to pregnant people, recognizing changes in their physiology, learn things like the Krebs cycle and things you never want to subject yourself to having to review. And I was struck in my clinical training at how I learned all kinds of complex things, but for my patients I was caring for with mental health conditions, like it didn't matter. It didn't matter that I understood HIV perinatology and I had read the textbooks and I could, recite what the best evidence-based care was. Because if they were suffering from a mental health condition, access to that care was incredibly limited. And during my fellowship, I lost a 21-year-old postpartum individual. And while the loss was related to a lung infection that was attributed to AIDS, at the end of the day, all of it, in my mind, is attributed to untreated major depressive disorder. And so it was a really humbling moment to realize that I had gone through all of this training, and yet I didn't really know the thing that was the most impactful, which is really to be able to provide accessible and acceptable mental health treatment. And so I very humbly have dedicated my career to trying to bridge this chasm and to incorporate mental health into maternal health, and to kind of enforce this notion that if we're going to be maternal fetal medicine physicians, we have to incorporate maternal mental health into our training, into our paradigm, into the research we do. So that's, something I'm incredibly passionate about.
Changing the system. We love it. Thank you, Emily. Amy, let's hear from you next.
Hi, everybody, and thanks again for having me on the panel. I'm so honored to be sharing the stage with all of you. I wanted to share that. So I have 3 kids. I had doulas at all 3 of my births. I'm grateful to have had the support of doulas at all 3 of those births. And I know that from my first birth, when I was, first time, person in labor, I was giving birth at a teaching hospital, and I know that the doula helped support me to advocate for myself, and in the end, help avoid what in retrospect was a sort of relatively minor procedure, but we also know that in some hospital births, oftentimes one procedure leads to another. At the time, I was a legal aid attorney working in Oakland, and I think for me, it was really very visible to me how much I had benefited from having the support of the doula, but at the same time, how difficult it was for many of my clients to get that same access, just because doula care, especially in the Bay Area, can be quite expensive. I think I paid something like $1,500 for the cost of that doula. So I think now in my work at the National Health Law Program, I really have been working a lot on sort of kind of more basic access issues, right? So, one of the big things that we're working on is trying to encourage the states that have not yet expanded Medicaid. There are 12 states that have not yet expanded Medicaid to just go ahead and expand Medicaid under, this is the option that was available under the Affordable Care Act. Important for the topic that we're discussing today as well, a report by the Center on Budget and Policy Priorities has found that states that have expanded Medicaid, they have seen reductions in racial disparities in health outcomes, coverage, and access to care. Secondly, related to my own personal experience, I've been working on trying to expand access to doula care, including Medicaid coverage for doula care and doula care for populations that are most impacted by maternal health disparities, including Black and Native American, Indigenous, pregnant, and birthing people. And then thirdly, and these are all issues that I think Congresswoman Underwood, you've worked on as part of the Black Maternal Health Omnibus as well, expanding the Medicaid postpartum coverage to 12 months to ensure that we have that continuity of care for those who would otherwise fall off coverage in the first 2 to 3 months following the end of the pregnancy. So, we know that many of the physical, mental, and behavioral health challenges that come up for individuals that we've heard today at this panel, and then also throughout the course of the forum, a lot of those don't necessarily occur within the first 2 to 3 months following the end of a pregnancy, right? Many of those may come up 8, 9, 10 months. So expanding that Medicaid postpartum coverage to that full 12 months really gives pregnant and birthing people on Medicaid that same extended coverage after birth that Medicaid has long provided for newborns. And thanks for letting me share about some of these efforts.
Thank you, Amy. You bring up an important point, and we all know how critically vital the Medicaid program is to ending the maternal health disparities we see in this country. And we are hopeful that we will see some movement at the congressional level for a mandatory expansion. Right now, we have an optional expansion. My state of Illinois was the first to take advantage, but we want all 50 states to be able to benefit from this type of expanded coverage. So thank you. Last but not least, we have Anna. Hi, Anna. Anna, you're muted.
Of course, of course. Thank you so much. Thank you, Congressman Underwood. And I just appreciate everyone's valuable story and the narratives that I've heard today. I appreciate you sharing that. And I would just echo a lot of the policy pieces that Amy brought up, because those are also a huge concern in terms of the Medicaid program that we work on at CHCS. And I think, first of all, we are in just a crisis of challenges with Black maternal health morbidity, and also, severe morbidity from pregnancy. That doesn't fall into the mortality category, but that falls into the sometimes lifelong consequences of birth outcomes. And with that intersection, I think some of the concrete challenges that we work on are really, for me, that are most important is just developing and sustaining a culturally sensitive workforce that people can feel as though they trust, that they can identify with, and feel as though they see themselves in this workforce. And we have to be supporting Black and Indigenous doulas to be able to provide that culturally sensitive care. And there's a lot of policy levers I think that we can use to do that. I delivered my second child without any complications, but I did notice by about 8 months postpartum, which is a long stage in postpartum, that I had postpartum depression and anxiety, and just had these feelings of maybe my family would be better without me, feelings that I had never had before. And fortunately, from my position of privilege, I was able to see a psychiatrist and see a psychologist and get the support services that I needed. I cannot imagine someone going through that without having the infrastructure in place, because those thoughts are very real. I think at that time in postpartum, a lot of cultural messages are that you're supposed to be so excited and so happy about your baby and your family, and often that's not the case that women are feeling inside. And so I think access to the supports that are needed during that time is most critical, and particularly in Black and Indigenous communities, which really are dealing with not only the challenges of being a new mom or a second-time mom, a third-time mom, all of those challenges, but also dealing with structural and interpersonal racism within the system. And so those are the big issues that I want to highlight today.
Thank you, Anna. One of the things that has come out of so many of your remarks was commentary about isolation and the duality between isolation and a solution of community, whether it's a local group, a group based in your health system, or led by a provider, or even groups like 2020 Mom. And I just wanted to take a minute to recognize how important this community is in this larger sense of support network across the country that we are seeking to build. So earlier, I described the legislative efforts that I've been leading with my Black Maternal Health Mommy Bus Act, the legislation that we've introduced in Congress. But now I'd like to ask our panelists to each tell us what their #1 policy priority would be if you could get anything passed and signed into law, right? So wildest dreams here. And let's start with Emily, who I know will have to leave us shortly.
Thanks so much. This has shifted a little bit with the current threats to reproductive justice, but those are really palpable and pernicious, and I'm terrified, to be frank. I think policies to ensure that obstetric clinicians can continue to practice reproductive justice-focused care are essential. And just to be explicit, that means supporting women and other birthing people having the right to have children and raise those children in a safe and healthy environment, but also to not have children. And, I see this on the daily that this threat to care is dangerous both for perinatal health and perinatal mental health. So we need that wand pretty quickly. But I think that would be priority number one from my lens right now.
So access to abortion care. Thank you,
Absolutely.
Emily. Thank you. Next, we'll go to Kay.
Well, if you know me, you know I'm going to say Moms Matter Act. I need that to go through. I need I need all of it, and so with that, I need a whole package. I need the whole mom in the bus as well. But if I'm going to pinpoint, it's definitely going to be Moms Matter Act. That's detrimental to where we are in the community and how we are focusing or need a bigger focus on maternal mental health right now.
Thank you. We love the Moms Matter Act. Okay, next, let's go to Yvette.
Thank you. It is really hard to follow after everyone's suggestions. I was really thinking about this last night as I was preparing, and I had a lot down. For sure, Moms Matter Act, reproductive justice, but for me, what I started thinking about is how it gets lost in translation when we make policies. So what I call a peer support, or what I call peer support, what we know as peer supporters are community health workers and doulas. We call comadres, we call promotoras. What everyone else calls OBGYNs and midwives, we call parteras, we call womb healers. So to me, it's yes, we need to pass all this, but how can we? And I guess it's a question, that I might be giving a longer answer to, but it seems to be an enigma of how can we create policies that do not require assimilation? And I don't really have an answer for that. I can only speak to my community and my culture, and because that's my lived experience. But I feel like sometimes there is the tricky part is trying to figure out what policies do we support, and how do we collaborate with policymakers where we're not surrendering our autonomy and power in order to be reimbursed. And that goes back to like the acknowledgement of traditional birth keepers and doulas and community comadres, which is, our peer supporters that have been doing this work for a very, very long time, and they ensure that this knowledge continues to act. So I guess for me, I would love for these policies to include a clause of some sort that acknowledges the experience of that acknowledges the experience of our culture. And I don't know if that's I'm sorry, that's not a very specific answer, but it was just something that I was really contemplating on how can I get that across in a way that is meaningful and impactful, and ultimately that the women we're serving are able to still hang on to that part of their identity.
Well, Yvette, I think you're spot on, because one of the things that we know the literature tells us is that when we have providers that have some kind of similarity with the community that they're serving, whether it's, language or culture or ethnicity and background, the outcomes are better. And in the work that we do in the Black Maternal Health Caucus, we believe that, every birthing person should have a choice in their providers, right? And so what I hear from you is that creating a framework where it's not just about a provider credential, right? But also lifting up these cultural and maybe community trusted individuals as part of a birthing team, and making sure that there's space for them as we seek to transform and reform maternal health care in this country. Thank you. I'd like to go to Teresa next.
I'm right behind you, Yvette and Kay. I'm all for the Moms Matter Act. It's so inclusive of so many things that are essential to move this issue forward in a positive and solution-oriented way. One thing that I know I would have loved to have access to as a Medi-Cal recipient. Mind you, I just recently got off of Medi-Cal. I've been in and out of the system for a lot of personal matters, but had I known that talk therapy was available to me and I didn't have to really comb through the system and do a lot of the research on my own, which was really exhausting, it would have been, I would have utilized that resource years ago. At the very start of becoming a mother, I would have loved to have some support. I had a lot of questions. I actually didn't even know how to frame the questions because I didn't understand the feelings that I was actually experiencing. In addition to that, which is why the Moms Matter Act is something that I wholeheartedly support. We need access to doulas and midwives, the bare minimal. We need the support, and we also need to make sure that mental health professionals are made available to the mothers that are in need, and to all mothers, but in particular, Black mothers, because we walk into this world, we're born into this world with a tremendous amount of trauma that's kind of just really embedded in our DNA system. But when you give birth to your child, you're not only combating what you're currently going through, but you're also wearing the weight of the ancestors that came before you. So yes, Yvette, it is really important that we have cultural representation and we have access to those who really understand our stories.
Thank you. Amy, over to you.
Great. So I think, kind of going off my my sort of theme of access, I would really push for universal healthcare for all, regardless of age, regardless of income, regardless of employment, regardless of immigration status. It would be universal healthcare that's high quality, that's comprehensive, that's affordable, and that also promotes health equity and reduces health disparities, including racial disparities in care. I hope this isn't too much. I hope my wish wouldn't be too much like when you're wishing for wishes, but if it is truly universal and high quality and comprehensive, it would include the full range of reproductive and sexual health care, including abortion care. It would include comprehensive mental and behavioral health care services, including for substance use disorder, and it would be culturally congruent and culturally competent.
Thank you. Well, the assignment was wildest dream, so here we are. We have to put it out there. Thank you, Amy. Anna.
Thank you. Yes, I just want to put a +1 and a cosign with all of my panelists, because I just want to endorse your wishes and dreams as well. They all really resonate. And I'm going to pick up on the thread that and Teresa were talking about. The wish that I put down is sort of, it could seem small and technical, which is really to expand the midwifery workforce. But I do think it's a critical practice and an ancient practice that's been going on. I had a midwife for both of my births, and I feel like it was the thing that changed the trajectory of my birth experience and really how I view maternity care in general. And I feel as though I really liked that how you talked about not assimilating and instead having this huge healthcare system accommodate and change itself for practices that are more evidence-based and culturally sensitive. And so, my pie in the sky is really to have a collaboration and regulatory changes and other things to expand the midwifery workforce so that people have that experience, one that's culturally, that is racially and culturally sensitive, so that people are able to find the providers that speak for them most in that most intimate journey.
Thank you. That's the dream. That's the hope, that we all might find those providers. So as we wrap, I'm going to do one more round to everybody and see if there's anything that you want to leave the audience with, anything you want folks to know, anything that we didn't cover, or anything that gives you hope. Okay. And so let's go to Dr. Miller first.
Awesome, thank you. So I talked before, I'm a health services researcher, and I think something that's really promising and pragmatic as a baby step to get to these big dreams that we all share is a system called the collaborative care model. And we've implemented this here. It's really well studied in primary care, not as well studied in perinatal context. And we've implemented this here in Chicago at Northwestern. It's been incredible. And I think really important when we look at health services interventions is obviously improving overall population level care. But I think equally important, if not more important, is how does that program alleviate disparities, existing disparities in care? And so some of the work that we've just put out shows that this implementation not only improves how OBs screen and recommend treatment and talk about treatment, right? Because we have support behind us to do it, it's integrated into our practice, but it also eliminates the racial disparities that we've seen in these health process measures. So, you know, it's a baby step forward, but I think there's a lot of exciting movement to implement this more broadly. And, you know, I'd love to continue to talk with anybody about how to do that.
Well, thank you, Dr. Miller. We love an evidence-based intervention. So I'm sure you'll be hearing from many of the viewers who are seeking more information on your program. Thanks for the work you do, and thanks for joining us this afternoon. Okay, so let's go to Kay next.
One of the things that I would like to leave folks with is what community partnerships looks like. It's not what you think. It's a lot of work. It is us holding hands, staying holding hands, investing in each other to build out what that relationship looks like. Of course, Congresswoman's office has done a great job of working within the community, but we'll really like to see a lot of more collaborations with those of us that are on the ground, because we do have the answers, or at least the valuable input that could help shape a lot of what policy looks like. You know, some of the things that are left out that oftentimes leaves community out. If the verbiage is not there, then community is left out, right? So it's really, for me, about bringing up the true value in building out what community partnerships look like and how they can be most beneficial. So just thinking on a broader level when we think community partnerships.
Thank you, Kay. Let's go to Yvette.
Thank you. And so I think I would like to just reiterate and just express how important it is for policymakers to come with humility, with an intention of understanding the community that they're trying to, you know, write these policies for, and to help pass policies that distribute resources to allow us in the community to do the work that has been shown to be effective and preventative, that we've been doing for a very, very long time. It's important for cultures to have space to rebuild themselves, to recover from systemic oppression as a result of colonization, and giving us space to revitalize ourselves and bring back the living knowledge of healing that we embody and that we all carry. And there's so many different ways, but we are a grassroots organization, and so I understand what it's like to really work and be part of the community and heal from within and extend out. And I really think that policy makers, you know, funding community-based organizations that are already doing the work is really important, and that includes, I mean, maternal mental health, but that also includes like doulas and peer support, and allowing us to keep those titles that we have known for so long, and funding and reimbursing individuals that have been doing this work for a long time, but that also, like I said, have that lived experience. Because there is, I know for me, as soon as I was able to connect with other women, I'm sorry, other self-identifying women, and that went through something very similar to me, I then found healing, and that the healing then turned into passion to want to help heal others. And so, yeah, I think that's all I have to share. Thank you.
Thank you. Teresa.
What do I want to leave behind? Well, before I leave, I want to say thank you again for your time and your energy and for this space to have this conversation that's so essential. But what I want to say to the audience, I just want to kind of step down from the policies for just a moment, because we're all having a very human experience in a very trying times in this world. So my reminder to myself, the panelists, to all of the attendees, is remember that you deserve to rest. I know that we're all on the ground and we're working really, really hard. And being a change maker is a really, really heavy responsibility. And I'm so grateful for the position. But on the contrary, I just want to make sure that we all remember that we are still human and that we can all take our capes off for just a moment, and rest is essential. Aside from that, my position and my activism really is rooted in storytelling. A lot of people, we're still trying to form the voice that is brave enough to say, hey, I need help, or I don't have this together. And it is really important that as a community that we invite more vulnerability, because within my own individual vulnerability lies my strength. I never knew that I would be doing this for the rest of my life. I never knew that I could turn my pain into my purpose. And so with that being said, I just want to encourage everyone to continue to tell your story, to just simply check on your neighbor. It doesn't take a whole lot to just pick your phone up and to call a mom, whether she's a new mom or a mother of many. So I just want to gently nudge everyone to breathe while navigating this space, because it is really triggering all the time. And I also just want to say that I'm proud. I'm proud of everyone on the panel. I'm proud of myself. I'm proud of all of the work that's being done, and I'm really looking forward to linking arms with all of the change makers to make these policies go through. We deserve them. So Congresswoman Underwood, I appreciate you, and I love that you look like me. I love that I see me and Kay and all of these other incredible women that are of color. In order for me to achieve it, I have to see it, and I see it today. So I'm grateful. Thank you.
Thank you, Teresa. And thank you for sharing your talent and your art and your vision with all of us. Let me go to Amy now.
Thanks, Congresswoman Underwood. So I wanted to actually go back and echo something that Dr. Miller said. I know she jumped off the panel, but since January 1st of this year, there have actually been more than 519 abortion restrictions that have been introduced as legislation in 41 states. And with the current makeup of the Supreme Court, which unfortunately is not going to change even once Judge Ketanji Brown Jackson is confirmed, although certainly her confirmation is historic, and I and many will celebrate it. Roe v. Wade continues to be under threat. So I think important for us to remember, or those of us, the forum, to remember based on the kind of topics that we've been discussing today, places and regions that restrict reproductive and sexual freedom, including access to abortion, also traditionally have the fewest policies to support birthing people, children, and families. And even more directly for what we're discussing today, states with more abortion restrictions also have higher maternal mortality rates. So I think it's really important to remember that if we care about saving the lives of pregnant and birthing people, we also need to work to ensure that those pregnant and birthing people have access to that full range of reproductive and sexual health services that all people need access to, including family planning, contraception, and including abortion care. I didn't want to end on sort of like a bad note, so I have a couple of positive things. So first, alongside those 519 abortion restrictions, there are also many, many states that are passing abortion protections, expanding access to abortion, trying to help ensure trying to help ensure that abortions are more affordable, and other things. So please, please, please keep an eye on those as well. And if your state is, sort of pushing forward some of those efforts, really try to support those. And then secondly, I wanted to mention that, at the National Health Law Program, we have a project called the Doula Medicaid Project that has been tracking efforts to expand access to doula care across the country. There are now currently a dozen states that are in the process of implementing Medicaid coverage for doula care, and probably about another dozen that are pushing forward sort of like doula Medicaid adjacent efforts. And so to echo what I think Yvette has been talking about throughout the panel, really, I think it's really important for doulas, advocates, and other stakeholders, especially in those states that that do have current efforts or are currently in the process of implementation, to really push for implementing these programs in an equitable, sustainable, and inclusive way. Here in California, where I am based, we are rolling out Medicaid coverage for doula care. There have been a lot of challenges in our conversations with the state Medicaid agency, but we are lucky that we have a really strong group of Black community-based doula leaders that are really holding their feet to the fire, I think, and making sure that this passes in a way that is going to work, not just for the Medicaid enrollees getting the service, but also for the doulas providing care.
Thank you, Amy. I don't think of it as negative. I think of it as keeping it real. And sometimes we have to have these kind of frank, open, and honest conversations about what's happening in our country. So thank you for giving us that information. And Anna, over to you. You're muted. Yep.
I'm so sorry. It's like my first Zoom, right? No, thank you so much, Congressman Underwood and everyone on the panel. I've just been really inspired and also moved by everyone's stories. And the place that I'm really landing is a hopeful place. Like there are a lot of ways you can look at this and from a hopeful angle. One is the stories that people are telling in the way that Yvette has encouraged us all to like learn about each other so that we are in this community together. And so I'm inspired by hearing everyone's story and to be able to share my own. And I appreciate you all creating space for that. On a technical policy level, which is, a place that I tend to live, there are a lot of efforts underway. There, at the national level, at the federal level, at the state level, there are efforts underway, both on a macro level and on little levels, like just making sure that doulas have, a livable wage wherever they're practicing. These efforts are happening. They're involved. Doulas are involved at the table. Other stakeholders are at the table. And so, you can feel hopeful that even if you don't know all the nitty-gritty details, there are people who are plugged into all of that and making sure. And I put Congressman Underwood and Jack in that category, who are making sure that these policies are ones that are actually going to affect people on the ground. And so that is something hopeful for me. And I just appreciate hearing more about that today and again, this panel. So thank you so much.
Thank you, Anna. And thank all of our panelists for your time this afternoon. Thank you to 2020 Mom. I want to just lift up something that Joy put into the chat, which is that all of our viewers had the opportunity to reach out to your members of Congress and to ask them to support our Moms Matter Act. This is bipartisan legislation, which means there's something in it for everybody, including all of us. When these resources get deployed to our communities, we need every single member of Congress behind this legislation. And in order to get there, we need your help. We need your voices. Thank you for your time. Thanks for having me. And I look forward to continuing our work together.
Wonderful. Thank you so much, Congresswoman Underwood, for being our voice and leader in the halls of Congress. And also congratulations again on receiving your award as a maternal mental health hero. Kay, I also just want to acknowledge you again for your leadership in so many ways, behind the scenes, sometimes on the stage, and mostly behind the scenes, for shepherding this important legislation, the Moms Matter Act, forward. Without you and the Shades of Blue Project, it really wouldn't have been possible, and we need to keep up the fight. So do click on that link, audience. And then Teresa, I also want to just say thank you for your beautiful storytelling. Your film is incredible advocacy that I think our field has been craving and wishing for quite some time. And I'll also just quickly share with the audience that Harpo Productions has been in touch. Oprah's Harpo Productions has been in touch with Teresa. And so we really hope that your success will continue and the film will continue to get all the attention it deserves for your sake and for our sake as a field. So thank you all. Thank you, panel. I now am going to ask everyone to join us with our word cloud to summarize what you gained from this morning and from this panel. You can go to pollev.com/2020mom and add the word that resonated with you the most, or a phrase with an underscore underneath it for multiple words. Let us know what you're thinking. We want to hear what you got out of this powerful morning so far. And we'll pop up that word cloud here and see what you're telling us. Strength, support. advocate, community as currency or commerce. Collaborative care, blown away. Yes, that's good. That's a great way to encapsulate the morning. Equity, Medicaid. I see the word beauty there somewhere. Okay, wonderful. So as usual, we're gonna give you a moment more to add your words and your phrases. We will save the final word cloud to Huva for each of these sessions. So join us after today's event to go back and take another look there.